Just a quick one to that interview you had last night. So the persons who've tested positive, where are they now?
All right, thank you. Good morning to your listeners or viewers, eh?
Viewers, yes.
All right, okay. So what's happening is that we have some protocols for health management at the airport.
Okay.
Which involves or includes the COVID-19 testing. Now, when you pick a case that is positive, usually the fellow who is positive, by the time you get to airport health, the port health desk, your results will be on their system. So if you are positive, what we do is that you are shepherded through immigration quietly, and then you are taken to a holding room, which you have at the airport. It's like a provisional isolation center.
Mm-hmm.
So at the holding room, your examination is done just to put you in a category of either in a critical state, that's red, in a mild state, that's in a moderate state, that is yellow, or in a mild state, that is green. That's tragic. Now, that is done quickly. Whichever category it belongs to, you are taken straight to our isolation center, the stage one, at the Pentecost Convention Center.
Okay.
Now, if the fellow has comorbidities, comorbidities like heart disease, kidney disease, liver
hypertension,
disease, and
diabetes, yeah.
Yes, increases your risk of getting a complication or even death.
Mm-hmm.
So once there's a comorbidity, usually as part of the protocols, you have to go to Ga East so that at least we observe you for some time and be sure that your life is not at risk. So after the assessment, we then decide whether you are kept in isolation at the Pentecost Convention Center or you are kept under treatment or observation at the Ga East Hospital, or if there's no risk, you are all okay, then based on where your residential facility is, if it's a place that we can vouch that you are in the house alone, you don't pose risk to anybody, we can have a way of monitoring you 24/7, then there can be the option of doing isolation at home, usually with supervision from the district that is involved. Remember, all these cases are fed into our national system, so we follow you just like we do for others. Yes.
All right. Doc, so who is bearing the cost? I just want to find out if they have to go to the Ga East or have to go to the Pentecost Isolation Center. Who bears the cost of this?
For now, unless it changes, what I can say confidently is that I have mentioned is that government's policy is to take care of everyone who has been confirmed as a COVID case for free in this country.
All right.
In discussing the cost that the traveler will absorb, the only one we mentioned was the testing. As far as I know for now, unless maybe it is reviewed, when they go to the hospitals, we are going to take care of them. Unless maybe the fellow has some medication that they take themselves, which they brought with them, which is not part of our protocol, then they might have to take care of that. But the basic things we do for a COVID person, even if it's ICU, the state would handle this one. Yes.
Doc, clearly these 6 cases we have recorded justifies government's position to have a test even after a PCR test. I'm sure that you feel justified by it, but not in the negative sense. But there are those who also say your nets have been able to capture those who may have slipped through the first PCR test that they had to bring into the country. But what about those whose viral load may not be that much to be captured and may be let through the net? They are suggesting that let's just do what we did with all those who came in the country initially prior to the closure of the airports. Let's just have all of them observe the 14-day mandatory quarantine. What would you say to that?
I think, there's a lot of impact that can be positive or negative if you have an airport that allows people to move in, go and do what they want to do, and then step out. Asking them to go into 2 weeks quarantine, as we were doing before this arrangement, came with its own challenges and its own, obstruction to all kinds of activities. That is why we went in for this testing regime, which goes in to identify the virus itself, like a PCR. Now, the first people with quarantine mandatorily when we started our COVID situation. Remember, we picked about 100 plus cases. All these cases were picked with antigen testing or PCR testing, which went to identify the virus. If we had done these tests we have now at the airport, I can say that 99% of all those who we caught would have been caught even at the airport without going into the hotel. So what you do as a country or in managing a health situation is to reduce the risk drastically, close to zero. You can't eliminate the risk totally. When I say elimination, you can't say that I get 1,000 passengers and I want to have a foolproof absolute. No. But you go for a measure that can reduce, and when I say reduce, that if there are 100 cases, can pick 99 or all the 100. And that's the kind of regime we have at the airport. Look, there is no, you can never say never in time. Whatever you do, even if we keep them 2 weeks at the hotel, you can have people who are fine, nothing happens, and then some complication will arise. So I think for now, I am happy that you have even mentioned the fact that when we wanted to do the testing here, it was not to create a burden for anybody. It took us just 5 cases of COVID imported into this country to send us to where we had to go on lockdown, where schools must shut down and all that. You can't take that risk. So let's continue to cooperate. Let's encourage those who are part of this process so that our inspiring situation now, as I speak, our total active cases as a country is just about 780 or so cases, less than 800. We want it to continue on the downward trend. The biggest risk to our COVID situation in terms of it getting worse is importation of the virus, the airport. And that is why some of us stand with the president that whatever it takes to catch all those with the virus, we should do it, even if it's 2 cases.
All right.
Only 2 can jeopardize our situation.
Okay, finally and briefly, there were also concerns about importing different strains of the virus than what already exists. Do we know the positive cases we've recorded, are they the same strain we are used to?
So usually, what you are interested in, first of all, is whether the virus is present.
Okay.
You catch it and you are good to go. The second leg, to find the kind of strain, you must usually do a PCR test, which does not only identify the virus, but can give you the sequence of the virus. And another name for PCR is nucleic acid amplification, which is that it gives you a bigger picture. It is the PCR picture sequence that will tell you whether this is the strain that has mutated or changed from the previous. Those are for academic and vaccine development purposes.
Okay.
But for treatment purposes, once you identify a virus, you are good to intervene early. Yes.
Thank you very much for your time this morning, Doc. I appreciate it. Dr. Okoboy is Deputy Health Minister, and we've been talking about the 6 positive cases we've picked up at our airport since it was reopened. But my colleague, Emma Pau, had a tour of the airport and came through with this.
Edition of lockdown from the airport Terminal 3, and today we are getting unfettered access through the process. It's exactly a week ago since the president announced the reopening of the Kotoka International Airport. We are here today to witness it firsthand, and thankfully we have our special tour guide with us here tonight. Thank you very much, sir. Welcome, and introduce yourself to us.
All right, my name is Eric Prempe, Customer Service Manager, Ghana Airports Company Limited.
Okay, so before we begin our tour, what are we to expect?
Okay, basically this section of the airport is arrival hall. What we are going to do now is to take you through the arrival process, because as you're aware, there are new protocols now, and as we go through, you see all the new processes that has been introduced as part of ensuring that all passengers facilitation goes through smoothly.
So since Tuesday, recount to me how it has been since the introduction of these new protocols.
Oh, so far it's been good. It's been more of sensitization, because some of the passengers had no idea about the new measures. So there's been a lot of sensitization. We've done more publicity, and even at the airport we reinforce it through announcement, and also We have customer service officers on the floor to educate passengers about the new protocols. So I would say so far so good. So before they reach here, there's a customer service person here who will announce to all the passengers on the bridge to ensure that they have all their nose masks on. We have sanitizing stations at the bridge, just at the exit of the bridge, so that passengers will use it to sanitize their hands before they get to the terminal. And also, as you can see, we have social distancing markings on the wall, so that at least we announce to all passengers to observe the 1 meter social distancing. So we board them in badges. So if, let's say, passengers are supposed to disembark on this concourse, as part of the new protocol, all arriving passengers on this level will turn on the left, because they'll have to proceed to the end, to the extreme end, and that is where the bank facility is set up, so that at least they will make payment, and after payment they will proceed to have the COVID test. Whereas previously it was manual, they just give them the cards on board to fill.
How would you say this will help in terms of the contact tracing? How efficient it will be?
Yes, because this system is also integrated with your bank payment and also your testing. So they'll give you codes so that at least it's integrated. So it makes it easier. If, let's say, you are tested negative, that makes it visible to even track you. So, and it captures all the necessary details, your passport number, everything, the biodata of the customer. Before you get to Port Health to get your result, they use that same system to even check whether if your results are in. Yeah.
So
all these tablets are internet ready, and if you can zoom in, you can fill it in English or French. So the passenger, yes, after this, they sanitize their hand. That's why we've provided sanitizing stations on my right. Okay, so
what is going on? What is happening? What is going on?
So do we have people on hand to help anyone?
Yes, anytime flight touches down, we have customer service officers and also some Port Health officials here to assist passengers to complete these forms online. Okay. And also we have, because we have Wi-Fi at the terminal, if this place becomes too occupied, we encourage passengers to connect using their phones through our Wi-Fi, and we give them the website address to connect. And
MFR Powell, there's more of that video on YouTube on the lockdown show that was aired yesterday.